Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Sandy and I am the Executive Officer of the Isle of Man Anti-Cancer Association and a cancer survivor.
And my name is Malcolm, Chairman of the Isle of Man Anti-Cancer Association and a former surgeon. In this podcast we want to talk about skin cancer. Cancers that arise on the skin account for a third of all newly diagnosed cancers. Although most may be treated under local anaesthetic by such techniques as simple excision or freezing of the lesion, there are a number that can be life-threatening if not caught early enough. More concerning is that the number of people diagnosed with skin cancer is rising. Most skin cancers arise through prolonged exposure to dangerous rays in our environment.
And we all like to enjoy the outdoors, whether on the island or off somewhere hotter for a holiday, sucking up the sun's rays, but we need to take a little care. Most of us feel a lot better with the longer, warmer and brighter days of the summer, and we all long for a relaxing holiday in the sun. But we have to remember that as the sun is getting higher in the sky, its rays are able to penetrate deeper into the Earth's atmosphere. Included in these rays are invisible, ultraviolet or UV rays, which are the main cause of skin cancer.
Some of you may feel that the sunshine on the Isle of Man is not really tropical in nature, and the changeable Manx climate protects us from these harmful rays. But, as a good idea of how intense the sun's rays are in the warmer months, even on the Isle of Man, is the surge of heat that can be felt when the sun suddenly emerges from behind a cloud. Even on very windy days, although we may not feel so hot, the rays are just as strong as on still days. What many of us refer to as windburn is really sunburn. Whether out for a walk, gardening, working or simply enjoying the outdoors, we need to protect our skin.
Sunshine is good for us though. We all need sunshine to help with our vitamin D levels, to help our bones keep strong. Sunlight also certainly helps to improve our mood. It can reduce our blood pressure and the risk of heart attacks and strokes. However, the amount of sunlight that most pale-skinned individuals need to maintain a normal level of vitamin D is much less than that required to achieve a tan. After all, from October to April, when the sun is lower in the sky and the days shorter, most of us are still able to maintain normal levels of vitamin D. A good diet can help boost your vitamin D levels, with foods such as oily fish, meat and eggs being naturally rich in vitamin D, while some cereals and drinks are also fortified with vitamin D. Pregnant ladies, children under 5, the elderly and dark-skinned individuals may require some supplements. Enjoying the sun safely and avoiding sunburn should help you to get a good balance.
Most people associate sunburn as being when your skin is blistered and sore, but just going red can be as bad as for your skin as well. DNA in your skin cells, which controls the growth of the cells, can be damaged even before your skin starts to go red. Cancer Research UK tells us that people can triple their risk of the most serious type of skin cancer, a malignant melanoma, by getting a painful sunburn just once every 2 years. This is particularly important for children. Their skin is more delicate, and even short periods of overexposure to the sun can lead to a legacy of skin cancer in later life.
So let's talk about the different types of skin cancers that can develop. The commonest is known as basal cell carcinoma, or rodent ulcer, which usually appears on the face as an ulcer with a pearly edge. Slightly less common is a squamous carcinoma, which develops as a crusted lump, usually on exposed parts of the body, that grow slowly and do not simply go away. The most concerning type of skin cancer, which affects a number of Manx residents every year, is what we call a malignant melanoma, and it can grow and spread quickly. It arises from the pigment cells in the inner layer of the skin, the cells that gives us a tan or give rise to moles, and initially it can look very much like a simple mole.
Everyone has moles, small pigmented spots, fairly evenly coloured, with a smooth rim that changes very little over time. So when should we become concerned that something in our skin may be more than a simple mole? For the symptoms and signs of a malignant melanoma, think ABCDE. A for asymmetry. It's not round or oval like a simple mole. B, border. This tends to be irregular. C, colour. It's mixed with light and darker areas. D, diameter. It's usually more than 7 millimeters in size, which is about the size of a rubber on the end of a pencil. And E, it is evolving. That is, it's changing in size, colour or shape over time. And it may also itch or bleed.
Now, there are ways in which we can look after our skin and reduce our risk of skin cancer. It also has the added advantage of keeping your skin and you looking younger. Use sunscreen. SPF 15 or above is recommended. Apply generously and regularly. A good tip is to carry a small travel-size sun cream in your bag or car so you always have some to hand when out and about. And you don't have to buy expensive sun creams. Just look for sun cream with a high star rating. And don't forget that sun cream needs replacing every 2 to 3 years because old cream may not give you the protection you expect. Try writing the year on the back of the bottle when you buy your new suntan cream, and that way you know whether it will still give you enough protection. Always remember that covering up also helps, so wear a hat, particularly one with a rim, or a brim even, and a long sleeve t-shirt, or alternatively, simply move into the shade.
Some people may be conscious of the harm that may come from sunning themselves, but still like a tan and turn to use of a sunbed or fake tan instead. Sunbeds emit UV rays similar to sun exposure and therefore present the same risks. It is illegal on the Isle of Man for those under the age of 18 to use a sunbed in a salon. As yet, the experts aren't sure about whether fake tan is safe. It needs further research into long-term effects. However, if you want a tan, current research suggests that it's safer to fake it than tanning on a sunbed or in the sun. A final point or two to consider is to get someone to help to check your skin, particularly moles, on a regular basis. There are parts of our bodies that we cannot really see very well that can get exposed to the sun, such as our backs or the top of our heads. And if you find anything that worries you, take a photo so that you have a baseline to compare with when you look at the lesion again a few weeks later. This can also be used to be sent to your doctor, which can speed up a direct referral to a skin specialist for further assessment and possible treatment.
And of course, as we say regularly on this feature, if you notice anything that's not right for you, get it checked out by your doctor. Now, for more information on skin cancer, you can visit Cancer Research UK Sun Awareness website, which is sunsmart.org.uk, or you can, on the Isle of Man, you can visit the Macmillan Cancer Information Centre, or you can call them on 650 735. So enjoy that sunshine, take care, and thank you for listening.